Okay, I think we're going to go ahead and get started. Good morning. Thank you all for being here. My name is Patty Urena, and I am the coordinator of education and outreach for Achieve a Family Trust. For those of you who are not familiar with Achieve a Family Trust, I'm just going to take a minute to tell you a little bit about us. Achieve a Family Trust is part of the Achieve a family of organizations, and Achieve itself has been in existence for more than 60 years and is one of the largest providers of supports and services for persons with disabilities in southwestern PA. The services offered go across the lifespan and include, among other things, early intervention, residential, employment supports, protective services, and advocacy. Achieve a Family Trust was created in 1998 in response to significant changes to Social Security law that created several types of special needs trusts for persons with disabilities. We were the first nonprofit in Pennsylvania to offer pool trust services, which require a nonprofit as a corporate trustee. Special needs trusts enable a person with a disability to protect assets that are in their name while continuing to be eligible for vital government benefits such as supplemental security, income, and medical assistance. And we will be discussing that today in our webinar. Achieve a Family Trust currently has over 2,300 accounts with more than $175 million in assets under management. If you want to learn more about us, please visit our website at achieveafamilytrust.org or just contact us directly. At this time, I'd like to take a moment to thank Neighborhood Allies for awarding us this grant that we are able to do these webinars on financial inclusion, and especially Sarah Dillman Perry for all of her help in putting these programs together. We are very excited to partner with them and the National Disability Institute to offer this series of webinars for financial professionals, for those with disabilities, and others who serve people with disabilities. We believe that these trainings will improve the financial well-being for those in the disability community. This is the third in a series of 5 webinars that will run monthly through April, and we hope that you can join us for the remaining webinars, which I will mention at the end of the program. Before I get started, though, I just have a couple of housekeeping items. You will have the opportunity to ask questions during the presentation. Please just type it in the Q&A box at the bottom of your screen, and we will try to get to as many as possible. Closed captioning is available for this workshop, and it is also being live streamed on the Achieva Facebook page. As a reminder, this program will be recorded and put on our website probably by the end of the day tomorrow, Monday at the latest. And that's where you can find the first 2 webinars that we did, titled Navigation of the Complexities of the Financial System as a Person with a Disability, and last month's webinar on disability awareness. They can be found on our website as well. So thank you very much. At this time, I'd like to introduce Sarah Dillman Perry.
Thank you, Patty. My name is Sarah, as Patty said, and I'm the Director of Economic Opportunity at Neighborhood Allies, based in Pittsburgh. For those not familiar with Neighborhood Allies, I'll provide a very brief overview of our economic opportunity work. We convene the Asset Building Network for general issues related to asset building and equity, the Bank On Coalition, which was just launched officially in November, with our partners, the City of Pittsburgh and the FDIC, and the Disability Awareness and Financial Inclusion Working Group, which is supported by the National Disability Institute. We also lead 3 direct service programs: the Pittsburgh Financial Empowerment Center, which provides free one-on-one financial counseling by trained and certified professionals, with our partners, the City of Pittsburgh and Advantage Credit Counseling Services. Fund My Future, a children's savings program that brings opportunities to save to local families, and Bank On Allegheny County, which provides safe and accessible bank accounts for those underbanked and unbanked. Anyone looking to get involved with these initiatives can get in touch with me. My contact information is on the previous slide, which you'll receive soon, and I'll also put it into the chat. The way that we got involved in this workshop series is through the Financial Inclusion Working Group. It started when National Disability Institute organized a Financial Inclusion Summit in November 2019, and then helped to launch the local working group. The working group identified several priorities and has been working to provide resources and key topics that were identified at the summit. We narrowed down the priorities to money management for people with disabilities, disability awareness and sensitivity for financial professionals, the Pennsylvania ABLE Savings Program, and understanding public benefits. Last April, we responded as a working group to an RFP from the Heinz Endowments and FISA Foundation to address financial inclusion through a program called Moving Forward, Disability Inclusion and Access. I've added a link to the Moving Forward website here so that you can check out the resources on this page, including conducting a self-assessment of your organization's accessibility, improving accessibility of social media, improving website accessibility, creating accessible documents, creating accessible videos, planning an accessible meeting or event, and providing accommodations. We were awarded funding and have been working with Achieva Family Trust to plan the series of workshops and training that we kicked off in December. In addition to NDI and Achieva, I'd like to recognize my co-chairs, Chuck Reese of JP Morgan Chase and Katie Smith of Disability Options Network. Anyone on this webinar who is local and wants to join our working group can reach out to me. I'd like now to introduce our next speakers. Patty Urena will represent Achieva Family Trust, and then we'll hear from Elaine Cole of the Social Security Administration. Thank you.
Elaine, if you want to go ahead and get started, please do.
Thank you, Patty. Good morning, everyone. It's a privilege to once again speak to the Achieva Family Trust family and also talk about the importance of Social Security. Because as we see our programs, it is a journey from the beginning as a child, whenever you are receiving your first Social Security number, and throughout the years that you may be working, and then at the time that if you may need us, that a disability may come into effect, or if that age that retirement is near, and that you're looking to see what options you have available. But remember that Social Security is always with you. As the Public Affairs Specialist for West Virginia and Western Pennsylvania, I have an opportunity to speak to many different communities that have different needs, but the bottom line is the program of Social Security is to help you to become more sufficient in securing your future. So let's begin with the information about what the definition is of disability. When we look at this particular definition, it can seem overwhelming, but the bottom line is that if you have a severe medical condition that is expected to last for at least 1 year or may result in death, and this particular condition may be prohibiting you from working, then this is something that you may want to consider, is filing for disability. So therefore, you need to know if you have been working, what are the rules for duration of the work test? And that's all to say is if you have enough quarters in your Social Security history in which to actually qualify for the program of Social Security Disability, or as otherwise known as ssdi. So when we look at this particular chart, let's take a look at a person that is age 30. At that point, they would need to have 2 years or at least 8 quarters associated to their Social Security record in which to at least qualify to file for ssdi. In that particular case, what we would want to say is when should I apply for those disability benefits? So if you know by either going on to the ssa.gov website and you're actually taking a look at your particular record online, or you can contact the Social Security office and ask for a benefit statement to be provided to you so you can see actually what your particular earnings may be and what is recorded on your record. So you want to apply as soon as possible. We're going to process that application for the disability benefits, but once we send it to the Department of Determinations, who looks over those medical, the medical information that you have submitted, and they will make a decision within 3 to 5 months. Usually, if there's any additional time that may be added to processing that application to get a decision, is because possibly there's not enough information. There may be a request for an exam for one of the Social Security doctors in which to determine exactly what conditions they're to consider on your application. Now, if you are able to give us specific information regarding your conditions, this would actually facilitate a faster processing time, because if all the information is there, then we can evaluate it and then come back with a decision. So at that point, what happens next? As I stated, the Department of Determinations for this area, that would be the Greensburg State Agency that would be reviewing the information. Of course, they're going to check your history to make sure that you have enough quarters in which to have this particular application processed. And as I indicated, you would be able to go to the ssa.gov website and actually see your information and as how it's going to be evaluated. So at that point, the examiner from the Department of Determinations is going to take a look at the information, and at that point, they may be contacting you. So when they do contact you, the Disability Determination Services will either do it by letter to announce who is your examiner on your case. They may contact you by phone. If that is the case, you want to make sure that if you move, or if you change your phone number, or even if you change your email address, that you keep that up to date, because it's really important that if we need to contact you, we have the best record in which that we can do so. Now, again, as for how a disability determination is made, it's really a 5-step process. So at that point, are you working? Is your medical condition severe? Does your impairment meet or medically equal a listing? Meaning that if you go to our Blue Book, which is housed on the ssa.gov website, you can actually see different medical conditions and what we're looking for in which to make our determination. Then also, we're going to take a look at your work history. Can you do work that you possibly did before? And if not, can you do any other type of work? Meaning that we're looking at those vocational skills. Are we able to change how you are actually working? We're not saying that you do not have the disability. What we are saying is, can you work even with the disability? So at that point, we're going to go to that next step, and we're going to tell you about the decision that we have made based on the proofs that have been provided to us. So at that point, your examiner, they may have contacted you before, but if they're in a decision process, they're going to send you a letter. Either it's going to be approved or denied. If it is approved, you are going to see the exact amount that you're going to receive, when your payments will begin, and also the requirement of reporting differences in your particular health, or if you are starting to work again, you really should be letting Social Security know that information. If, on the other hand, it is not approved, the letter will spell out specifically the actual items that have been taken under evaluation from our doctors, and it will indicate why your particular benefit was not approved. Again, there's a whole process for the appeal, and at that point, you would have 60 days in which to do that, but that is a process as well. But just the best part to remember is making sure that you contact Social Security and let us know that you would like to appeal it within 60 days. So what about the benefits for the family? If you have a spouse that is age 62, if you have a spouse that is caring for a child that is under the age of 16 or has been deemed disabled, or it could be that you have a divorced spouse that may also qualify for a benefit because you have been awarded ssdi. As for children, they would be eligible as long as they're not married, either under the age of 18, or if they're still in high school, they can receive those benefits up until 19 and 2 months. But if that particular child is not disabled and they're still in high school at the age of 19 and 2 months, that's when their benefits would terminate. If you have an unmarried child that was disabled before the age of 22, then also they could possibly qualify for benefits based on your record or the worker's record. Next, you need to tell Social Security, number one, if you have an outstanding warrant for your arrest. Number two, if you have been convicted of a crime. And number three, if you violate a condition of parole or probation. Again, if any of these exist, you need to alert or have someone alert Social Security immediately, because if your benefits continue and you are under that particular either an outstanding warrant or you're in jail and have been convicted of a crime, if those benefits continue to come to you or someone in your family, then you would be overpaid. And at that point, that overpayment would continue to be on your record. So whenever you have been released from either jail or the conditions of your parole or probation, if you decided to come back on to Social Security disability, that overpayment would have to be resolved before your benefits start. So if you're working while you're receiving benefits, there are special incentives that are available that you can still receive your Social Security disability benefits, and also that you can get additional training, education, at that point in which that is going to help you to continue working. That's one thing, or a myth that is always out there, is that under ssdi, that many ask, can I still work and receive my Social Security disability? So whenever we're looking at that program, there are special rules that apply to that, and it is best to find out where you stand under those special rules whenever you are in that particular situation. The best way to find out if this applies to you is either going to our website, ssa.gov, or give us a call at 1-800-772-1213, or you can also Google right now for your local office, and you can go directly to your servicing office and ask these specific questions that will help you make those decisions. We're going to talk a little bit about SSI. Now, whenever we're talking about these acronyms of SSDI and SSI, this is all programs that are based under our disability part of Social Security. So when we're looking at SSI, we're not looking at anyone's work history, because SSI is a federal program that provides these monthly benefits to you that based on your income and resources. That's the difference between SSI and SSDI. As I indicated, SSDI has to do with your work earnings, which you have paid into the system under your Social Security number. But SSI is a little bit different. That number one, it has nothing to do with work history. We want to know specifically about your income and resources. It is available for those that are 65 years or older, and then also for children and those that are blind or have disabilities. At this point right now, we look at that our vulnerable population of either being over the age of 65 or any children that may be at a disadvantage, especially now during the pandemic. We want to make sure that you know that Social Security is open, and we may not be in our brick and mortar buildings, but we are available in other ways, such as that you can call your local office, but if you do not have the number, you can Google that information. Our 800 number is still being operated from 7 a.m. until 7 p.m. at 800-772-1213. And if you just don't know where to go, Achieva is a great partner in which to get that information to you. And I just want you to know that we are still connected with you. And if you have any questions, please do not hesitate to contact us. When we look at the requirements for getting SSI, to be eligible for SSI, you have to have limited income and resources, be age 65 or older, be totally blind or partially blind, or have a medical condition that is keeping you from having substantial gainful activity at work. Of course, because children are not adults and do not have the availability to necessarily work, there are different rules available for children. If, again, SSI, income and resources, where you live, make a difference in getting SSI. So if you have limited resources in your income, or just general that you have your home, a house, you're permitted to have that. But any additional resources such as bank accounts, cash, real estate, any of that will make a difference and could prohibit you from receiving SSI. Again, this is a needs-based program, so therefore these rules and requirements are necessary in which to administer that program. What is the different income? You're looking at wages, you're looking at that even Social Security benefits, if you're getting veterans benefits, unemployment benefits. And just to let you know, during this time of the pandemic, some of these unearned benefits are being exempted because that there are special circumstances like the pandemic that are lifting those particular items from being counted against your SSI benefit. As for resources, again, bank accounts, stocks, bonds, a second car, life insurance, property that is other than the dwelling that you're living in. Of course, if you have additional cars, all of that may be counted as your resources. Living arrangements, that makes a difference. So if you're living with a child and that child is receiving SSI, the bottom line is that that particular parent or custodial person that is taking care of the child, their income and resources may have a large effect on how much that they're going to be receiving for that child. So therefore, number one, please make sure that you answer all of the questions truthfully whenever speaking to the Social Security Administration. The issue is that if you do not provide us all of the information of who is living in the household, you could be risking that that child would not be receiving benefits, and also an overpayment would be assigned to their record. So it's very important that you really take a look at what the program can do, and also how you're going to administer that particular benefit for the adult or the child. As for right now, I just want to make sure to emphasize the differences between SSDI versus SSI. The easiest way to remember is that Social Security disability insurance has to do with the wages and the taxes that you pay into the program. As for SSI, it is all based on income and resources. It has nothing to do with a person's earnings, and it is strictly based on a needs-based public assistance program. So that's the easiest way to remember those differences. Next, We talked a little bit about SSI for children, but we just want to emphasize those particular eligibility factors and what exactly it is for. Again, a child that is under the age of 18, and also a child that has been regularly attending school under the age of 22. Therefore, let's talk about those SSI requirements for children. If you have a child that is under 18 and has these conditions, and of course, we're looking at the severity of those conditions, the child must be either blind or disabled. If the child is blind and meets the definition as listed under Social Security, then it would apply as for adults. The condition, like anything else, has to last for at least 12 months or result in death. Continuing with these requirements, we're looking at that if the disabled child is living in the household with limited income, then SSI could be a possibility. We see it again. Income and resources of the household, either the custodian or the parent, it's going to be part of the decision on how much we're going to receive from the program. Child support, anything to do with benefits that are coming into the household that it might not be for the child. Any type of gifts that, every month that you receive $50 from a grandparent, that is all income that should be considered against the SSI. Most importantly, it's for the child that is turning 18. At that point, that is what we consider an adult. We really need to take a look at what the child was actually approved for in their particular health condition under the age of 18 and compare that to what they are receiving or can receive once they become an adult at 18. So as for that child's application that may have been approved, it is very possible that as an adult that it might be a disapproved claim. So this is something that you definitely want to take a look at the child that is turning 18 to contact the Social Security Administration, because it could be that you really need to make that particular appointment so that there's not a delay in those particular funds. Because they're already receiving it and then we are notified that they're turning 18, we're able to facilitate that particular application a little bit quicker than just an 18-year-old or an adult that would be filing for the first time. As for SSI and foster children, it could be that they're transitioning from foster care, and at that point, there's differences on how their living situation is changing. Please contact Social Security. Again, we would need to make an appointment in which to determine how this particular youth would qualify for a benefit. when we look at the representative payee program, the bottom line is the representative payee, we are going to look at a relative or a friend or even an interested party to serve and manage that person's benefit. A lot of times, if it's a child, then at that point, we would want that adult in which to take care of the actual items that are necessary for this child to live comfortably. So that's a big responsibility. At that point, what we're saying to you is we're going to give you an amount of money on behalf of your child. However, we want to make sure that food, shelter, clothing, all of that is taken care of. At least once a year, Social Security is going to reach out to you and ask you to see what exactly you may have actually spent those monies on. At that point, if you had purchased something like a computer for your particular child, but all of the other needs have been met, at that point, that would be the right thing to do because this is helping your child. However, you find out, or I should say upon investigation from Social Security, and it is found that the representative payee for this child has not been paying for any food. They're looking at that there's going to be homelessness of that particular family, but the money has been spent on a vacation, going out of town, not necessarily spending the money on the needs of the child. At that point, we're going to look at misuse or an abuse of those particular benefits. So it's an important role that the representative payee does because they're actually handling benefits for another person, whether it's a child or an adult. It's a great responsibility in making sure that your loved one is being taken care of. However, there are certain times that people get miscommunication in regards to how they are actually to be a representative payee. So therefore, it is really critical that you pay attention to how you handle those particular benefits. Lastly, when you're applying for benefits, you do have three options. At this point, online, either by phone, and as I had indicated earlier, you can Google your local office phone number and they will be glad to assist you. Right now, our actual brick and mortar offices are closed to the public, but we still do have teams that are going in, getting your mail, getting your faxes, and processing your particular benefits. We are here and we are here for you. So at this point, I would like to talk to you a little bit about Medicare and Medicaid, and then I'm going to hand you off to Aaron, which will go into more details on the program. As for Medicare, that is our federal health insurance program. Usually it's for 65 or older, or the person that has been receiving ssdi for at least 24 months or 2 years, they are eligible for Medicare. The difference in Medicaid is that it's a state health program for people with low incomes and limited resources. And that is similar to SSI. They work hand in hand. So most states have the programs that are available for children that if you are receiving at least $1 in SSI, you qualify for Medicaid. In most states, Medicaid is automatic when you have SSI eligibility. So when you're speaking of Medicare, remember that has to do with an employee's wages. Medicaid has to do with my limited income and resources. So at that point, I'm going to hand it over to Erin.
So,
Thanks, Erin.
excuse me, this is Maria Smith. Hey, there are just a couple questions, Elaine. Would you be willing to answer?
Sure.
Okay, just a couple of things on the Q&A about that her son started receiving SSDI at 25. She's now retired. Can he receive Social Security on her retirement benefits?
Okay. If the child was considered disabled before the age of 22 on that particular determination, yes, they should contact the Social Security office, make an appointment for that particular disabled adult child, and they could be eligible for those benefits. But we really need to examine when they became eligible, if it was before the age of 22.
Okay. Another question is, if a person has been receiving a Social Security disability and they turn 65, does it automatically transition to retirement benefits? And can you wait till 67 for full retirement? It's just, how do those disability benefits translate to retirement?
Okay. If they are receiving benefits from SSDI prior to their full retirement age, it has changed a little bit. It's no longer that we're looking at the age of 65. What we're looking for is that it's an automatic transition from disability, that it goes into the actual full retirement. So there's nothing that particular disability beneficiary would have to do. It's an automatic process, because once you turn full retirement age, you cannot be a full retirement age beneficiary and still be considered disabled. So that's why it's an automatic process. There is no difference in the amount that you're going to receive. So therefore, if you are receiving SSDI prior to your full retirement age, there is no additional amount that would be added to your particular record.
Okay, thanks. And just two other questions, and then we'll proceed on. Someone asks about having a son that's 17 years old and autistic, turning 18. The question is, do they have to wait? Can they apply now for SSI, or since it takes a while to get the benefit, or do they have to wait to his 18th birthday? How soon can they apply?
What I would suggest is that a month before the child's 18th birthday, to contact Social Security, make the appointment. And because we have a lot of the documents already stored in our system, it should be a pretty quick process and turnaround for the Department of Determinations to make that decision prior to their 18th birthday. So 30 days prior to that date, that's when they can actually have that appointment.
Okay. And just one other question, and the rest of the questions that are in the question and answer, we will in fact get back to you through typing the answers. The question is, do the income and assets of a parent's count for eligibility for an adult? And the question is, does it matter if the person is claimed as a dependent?
Okay, as for our purposes, whenever you're saying that they're claimed as a dependent, that is an IRS issue. But as for if the child is now 18 or older and they're living in your household, what Social Security is going to do is take a look as if that particular beneficiary, are they paying their fair share of the household? For example, are they eating all of their meals at the house? So in that case, then they would have to be contributing to the food. If there's a mortgage or if there's rent, or they're paying their fair share of that particular mortgage or rent. All of those items would need to be discussed, and the expectation would be, if you are expecting that they're going to use their particular benefits in which to contribute to the household. That's what makes the difference, and that's the reason it's very important to have those discussions with your actual claims representative at your local office.
Okay, thanks. And I think we can move on now. We will get the answers to the other questions in written form. Thank you.
All right, thanks, Maria. Thanks, Elaine. This is Erin from the Health Law Project. I'm going to cover now some information about Medicaid for people with disabilities. So it's nice to be with everyone today, and we know this is a lot of information, so please ask questions, and I think you all will get the slides after today's training, and the recording will also be posted to Achieva's website. So just a quick overview of the Health Law Project, if people aren't familiar with us. We are a legal service program, so we provide free legal services to help people who are having issues getting public health care coverage or getting services through the public health care systems. Our main focus is Medicaid. We are part of the legal aid network, so we are similar to other legal aid offices in that our services are free to people, but we're different from other legal aids in that we don't have an income limit that somebody has to meet to qualify for our services. And again, our focus is very narrow and mainly limited to Medicaid with some minimal work and other public health programs. So if people need our help, they can contact our helpline or send us an email. If you call us, you will have to leave a message. We have intake staff that will get back to you, and we do our best to try to get back to folks as quickly as possible. And you can call us if you're denied Medicaid, or if you've been on Medicaid and you get a notice telling you that you no longer qualify. If you are denied services by your Medicaid insurance, you can call us for help, or if you're having problems accessing services through Medicaid. If you need advice about whether you might qualify for Medicaid, call us. Or if you need help understanding your Medicaid or how the Medicaid is supposed to work with other insurance you have, that would be another situation to call us. So if you call us and we can't help you, we do try to direct you to other resources if you're calling about something outside of our scope of work. Then we do trainings, education and outreach like we're doing today. We have a monthly email newsletter. So if people are interested in getting updates about Medicaid developments or other public health programs that can help people, join our newsletter email list. And then we do systemic advocacy based on the client work. You know, that helps us identify systemic problems. And we do advocacy to try to address the program problems and make the programs work better for folks that rely on them. All right, Sarah, next slide. So we're going to cover today Medicaid basics. We're going to talk about different ways to qualify for coverage through Medicaid, and then we're going to talk about how people can apply for Medicaid. So generally speaking, Medicaid is a federal health program So it's kind of a federal-state partnership. So the federal government lays out some broad rules that the states have to follow, but then the states have flexibility to design their program, and then the states administer the program. So in Pennsylvania, it's the Department of Human Services that administers our Medicaid program. And in Pennsylvania, we call Medicaid medical assistance. So if you see those two terms, medical assistance and Medicaid, that's the same thing. This Medicaid looks different state to state. So what we're talking about today is how Medicaid works in Pennsylvania. And Medicaid, as Elaine said, is health insurance for people with limited incomes and typically limited resources who fit into certain groups. And that's what we're going to talk through today. Medicaid can be the person's only insurance. There's lots of folks that just have Medicaid, but then Medicaid can also be secondary insurance for people that have Medicare, or for people that might have coverage through an employer or their parents' employment. Medicaid can be secondary coverage to other insurance people have. So Medicaid is a good comprehensive coverage with limited costs. Right now, there's over 3 million Pennsylvanians that rely on Medicaid for their health insurance. There's no monthly premium generally for people on Medicaid. The one exception is a program that we're going to talk about called Medical Assistance for Workers with Disabilities, or MAWD. And then when people on Medicaid get services, they really should only have small copays when they get services. Copays should generally be less than $4 per service. Kids don't have copays, and then there are some services that don't have copays attached to them. So it's an affordable insurance. Again, the benefit package is broad. It covers medical services, it covers behavioral health services, prescription drug coverage, dental care, some vision care. So those are just some examples of the benefits covered by Medicaid. And so oftentimes Medicaid coverage might be broader than employment coverage. So that's often why people need to turn to Medicaid, especially for children with disabilities. Right now, most people who qualify for Medicaid get their Medicaid coverage through managed care plans. And for folks on the call that are familiar with managed care plans, there are rules that have to be followed for the insurance to cover the care that you need. So people in managed care under Medicaid will have to use providers in their Medicaid plans network, and they have to follow rules for getting care, like possibly getting referrals, possibly their doctor is going to have to get prior authorization for services to be covered. So that's kind of an overview of how Medicaid works. We're going to talk some more about qualifying for Medicaid. So generally speaking, to get Medicaid in Pennsylvania, someone has to be a US citizen, or they have to be a lawfully present immigrant, which means they have to have a documented status in Pennsylvania, or documented status in the US. These immigration rules are complex. So if you are somebody trying to help, if you are someone who is an immigrant or someone trying to help somebody who is an immigrant qualify, reach out to us so we can kind of get into the specific situations, because the rules differ in terms of what kind of immigrant you are, in terms of what you can qualify for through Medicaid. And then in addition to the citizenship requirements, you have to be considered a resident of Pennsylvania. So there is no minimum amount of time somebody has to be in Pennsylvania. You just have to be in Pennsylvania with the intent to stay in Pennsylvania. So somebody that just moved to Pennsylvania last week, as long as they intend to remain in Pennsylvania, they can apply for Medicaid right away. And then you have to fit into a covered group or a category, and that's what we're going to talk about today. And then you're going to have to meet that group or category's income resource limit. So there are always financial guidelines to qualify for Medicaid. Now, Medicaid has a bunch of different categories, and these are just some examples. We're going to talk about some of these categories today. But the big thing to know is there's lots of different ways to qualify. So people, are encouraged to apply. You don't have to apply for a specific category. You just apply, and then the county assistance office, the Medicaid caseworker that processes your application, they'll determine what category you fit into. That's not, that's not the responsibility of someone applying. So someone should just apply and get an official decision from the county assistance office. And the other thing just to kind of keep in mind is that there's lots of ways to qualify, And Medicaid, depending on the category, there's kind of different rules for how income gets counted and whose income or whose resources get counted. So it's a good program, but it can be complicated because there's lots of nuances to the eligibility. Next slide, Sarah. Okay, as Elaine mentioned, for people that get SSI or supplemental security income, regardless of their age, if someone gets any amount of SSI, even if it is $1 of SSI, they get Medicaid automatically and they don't have to apply for Medicaid. This is the only category, this is the only people that don't have to apply for Medicaid, or the folks getting SSI. Pennsylvania is one of those states where Medicaid coverage is automatic if you're receiving SSI benefits. And then if for kids with disabilities, there's two ways that kids with disabilities can qualify for Medicaid. One way is based on their family income, and the income limit will vary depending on the age of the child. So at the end of the training, there's a resource that kind of lists out all of the different income limits for all of the various categories of Medicaid that we're talking about today. So for kids with disabilities, they will look at the family's income. They do not look at resources. So there's no resource determination for children when they're applying for Medicaid. And then for children with disabilities, if their family income is too high for them to qualify for Medicaid, there's a special rule in Pennsylvania where if someone has a serious health condition or a disability and they're under the age of 18, they can qualify for Medicaid where the parental income is not counted against them in the eligibility determination. So this is called PH95. If you've heard that term, that's what I'm talking about here. So when someone applies for this particular program, the parents still have to report their income, but it's not counted when the Medicaid office looks at eligibility. Again, resources are never considered for children to qualify for Medicaid. For this category, you do have to provide documentation of the child's serious health condition or disability, and Medicaid will require you to apply for SSI. And again, most families applying for the PH95 Medicaid, they make an appointment with SSI, they do a phone interview, and it's clear from that phone interview that financially they're not going to qualify for SSI. They get that denial, and that has to be provided to Medicaid, and then that's the end of that. So this is a really good option for people. And again, the Medicaid for kids, Medicaid's benefits are really broad. It covers orthodontia, braces, it covers skilled nursing services, the shift nursing services, it covers home health aid services, it covers some certain behavioral health services. So that's why families of children with disabilities often turn to Medicaid, because Medicaid covers things that aren't covered by commercial insurances, or it doesn't have the same caps or limits on services as employer coverage can. Okay, and then the next category to talk about is called Medicaid expansion. So since 2015, Pennsylvania has expanded Medicaid to adults who weren't eligible prior to Medicaid expanding. So since 2015, over 870,000 Pennsylvanians have been able to get coverage through this Medicaid expansion. So this is a really important category, and it can help people who maybe are in the process of applying for Social Security disability, or people maybe who have health conditions, but they're not at the level where they would qualify for Social Security disability. So to qualify for Medicaid expansion, somebody has to be between the ages of 19 and 64. This is a category aimed at covering people who don't have any health insurance. So you cannot be on Medicare and qualify under this category. There's no resource limit. So this is one of the few categories of Medicaid for adults where resources are not counted. And then the income limits are up on the slide here. Okay, Sarah, next slide. And then we're just going to talk about a couple categories of Medicaid geared specifically towards people with disabilities. So the first one is called Healthy Horizons. This is for people that are either age 65 and older, or people under 65 who have a disability that is expected to last at least 12 months. Again, Elaine talked about how that 12-month window is important in terms of meeting Social Security's disability criteria. And so because this category is a category for people with disabilities, Medicaid's disability determination is similar to how Social Security looks at disability. So if somebody's on Social Security disability, they've already been determined disabled by Social Security, you meet the disability criteria to get Medicaid under this category. But if somebody's not on Social Security disability, they can provide documentation about their disabling health condition. They have to provide some information that they have a condition that's permanent or a condition that's expected to last at least 12 months. Generally, they'll have to provide information about what treatment they're getting, and the expected, the treatment that will continue to be needed for their condition. And then you have to meet income and resource limits. And again, the big thing to know here, Sarah, sorry, can you go back real quick? The big thing to keep in mind with a lot of these categories for people with disabilities is if somebody has any earnings, only 1/2 of the wages or the earnings will count towards these limits. And we're going to talk a little bit more about this. Okay, Sarah. Okay, the next program I wanted to talk about is the Medical Assistance for Workers with Disabilities program. This is also called MAUD for short. All of these programs have their own language and own acronyms. And this is a really important program, especially for people with disabilities who want to work or want to work more. We talked to a lot of folks, as Achieva does, and other folks giving the presentation today that maybe are afraid to try to work, or they're maybe afraid to take a promotion because they're afraid of losing these important benefits that do support them and allow them to be as independent as possible. So this MAUD program is really great to help people who want to be able to work and who are able to work pursue those employment opportunities and keep their Medicaid benefits. So this is for people ages 16 to 64. Again, you have to meet disability criteria. So you have to either be on Social Security disability, or you have to provide medical documentation to show that you have a disabling condition, and that maybe your ability to work would be more limited if you weren't getting treatment or something, if it's a serious health condition. For MAUD, the Healthy Horizons and the kids with disabilities, the requirement is you have to apply for SSI and ssdi. But for MAUD, that's not a requirement. So people won't be required to apply for ssdi if they're not already on Social Security disability. Again, this is for workers with disabilities. So there is a work requirement. So someone has to be doing work each month, but there's no minimum work requirement. So somebody who's working just a couple hours a month can qualify for the MAUD program. There's no minimum amount of hours somebody has to be working per week or per month. And then the other thing to keep in mind is that informal work counts as work. So people don't have to work for a company where they're getting an official paycheck. Sometimes people maybe are walking a neighbor's pets or babysitting or doing some other informal work where they would have to provide verification, usually a letter. So if I'm helping neighbors walk their dogs, if that's something I'm able to do with my disability, then I would get letters from my neighbors saying, Erin walks my dog a couple days a week. She works, 4 hours a month for me, and I pay her X amount of dollars. So that can serve as verification for that informal work. The MAUD program is the only Medicaid program where people have to pay a monthly premium for the coverage. So the premiums are calculated based on whatever Medicaid determines your countable income to be. So it's after all disregards are taken. And then Medicaid calculates 5% of that income, and that's what the premium is. If somebody is married, the premium is only based on the individual who's applying for MAUD. It's not based on the spouse's income for the premium determination. And MAUD's premiums are often a lot less than other marketplace insurance or other insurance premiums would be, even through the employers. Okay, Sarah. So the MAUD program has higher income limits than other categories of Medicaid, and it has, a higher resource limit than Healthy Horizons. The big thing to keep in mind for MAUD is that only 1/2 of gross wages will count towards this limit. So if somebody only has employment income and their income is $45,000, only half of the $45,000 will count towards the income limit for the MOD program. So people might think that they're over income when really they're not over income once Medicaid kind of takes those deductions. And again, if people have questions about whether they're eligible for this program, please reach out to us at the Health Law Project or talk to the folks at Achieva. Okay, the other program I wanted to mention are the programs called the Medicare Savings Programs. And for these programs, help people who are on Medicare, either because they're over 65 or because they've been on Social Security disability for 2 years or more. This Medicaid program will pay Medicare costs. So the Medicare Savings Program pays the Part B premium. For Medicare Part B, anybody on Medicare, the Part B premium is roughly about $150 a month now. So if somebody qualifies for the Medicare Savings Program, Medicaid will pay that $150. And so they'll get $150 more in their Social Security check that's currently being deducted. And then for folks that have the least amount of income, Medicaid may also cover deductibles and co-insurance through the Medicare system. The other thing to keep in mind is if somebody has maybe Part A, but they didn't take the Medicare Part B, and I know we didn't really talk about Medicare in this training, but if somebody delayed taking Medicare Part B because maybe they weren't getting a lot of health services, if people join Part B later, there's late enrollment penalties. You're limited in terms of when you can get into that coverage. But if somebody can qualify for the Medicare Savings Program, that helps somebody get into Medicare outside of the normal enrollment periods, and it takes away any late enrollment penalty someone has. So this can really help people get into Medicare and pay for Medicare coverage. Okay, so just to kind of recap income and resources. So the Medicaid expansion category, they look at income different than the other categories we talked about. They generally follow tax rules when looking at people under the Medicaid expansion in terms of what income counts and doesn't count. But generally speaking, regardless of what Medicaid program someone is pursuing, Medicaid will look at gross income, but not all income counts towards the income limits that apply to the different categories. In terms of resources, if Medicaid does count resources or does have a resource limit, I'm going to talk first about what doesn't count. So the house you live in doesn't count. One car does not count. If somebody has more than one car, the car with the highest equity value does not count toward the resource limit. If somebody has an irrevocable or a prepaid burial account, that resource does not count toward the resource limits. And if somebody has an ABLE account, which are fairly new in Pennsylvania, but if somebody has an ABLE account, that resource is not counted toward the limit. And then, as Patty mentioned earlier at the beginning of the presentation, if somebody has a special needs trust, that trust document would have to be provided to Medicaid, but generally speaking, special needs trusts don't count toward the resource limit. So what does count are things like bank accounts. If people have retirement accounts, IRAs or 401ks or 403bs, life insurance will count. But the big thing to keep in mind is that even if a resource counts, the entire value of that resource may not count. So with life insurance, they're going to look at whether that life insurance has a cash value and count a certain amount of that cash value toward the resource limit. For retirement accounts, if somebody cannot access that retirement account, there are sometimes employers that offer retirement accounts where you cannot access that retirement account as an employee. So if you can't access it at all, provide documentation to Medicaid. Medicaid will not count that resource. But oftentimes people can access those retirement accounts. They might just have to pay an early withdrawal penalty. So Medicaid will count the amount you could get at minus any penalties or other fees that would be charged to access that money. And Medicaid looks at the income and resources at the time somebody is applying for the benefits. Okay, Sarah. Okay, so there's a number of different ways to apply for Medicaid. People can apply online, by phone, they can fill out a paper application. Right now, the county assistance offices are closed to the public during COVID, but people can still drop off paperwork at those offices. There are drop boxes outside of the offices that people still can access. So there's a bunch of different ways to apply for Medicaid, and people can apply for Medicaid at any time. There's no enrollment periods like there can be for other insurance programs. And even if somebody was denied in the past, if their situation's changed, especially, they can reapply. It doesn't matter if you were denied or if you were on Medicaid and lost it in the past. Anybody can reapply, and they look at your current situation when they're determining eligibility. Okay. So generally speaking, you can apply any of those ways from the previous slides. Just to kind of mention that even though you don't have to apply for a specific program, if somebody knows that they want to apply for the MAUD program, or if somebody knows they want to apply for the programs that help with Medicare costs, we encourage people to use the paper applications for those specific programs. And when you get the slides, there'll be links to those applications in the slide, because those are just simpler, they're more straightforward, they're getting the information that the county assistance office needs to look at you for those programs. Otherwise, you can apply on Compass, but you're doing kind of the whole full-blown Medicaid application, and you have to give information that maybe isn't relevant to these particular programs. But again, it doesn't matter how you apply. You can be looked at for any of these programs, regardless of how you make that application. Applications are generally processed in 30 days, and everybody who submits an application should get a decision in writing that says whether they're eligible or not. And if they're denied, people can appeal that denial. And if you get a denial, please reach out to us at the Health Law Project or talk to another resource, because sometimes people do get denied inappropriately. So it's good to just have a review in case something was not handled correctly that can be appealed or can be addressed otherwise. And then people on Medicaid, again, these are financially based programs. You have to renew your benefits every year. And then people have to report changes. So as long as people do that, then they're following their responsibilities. And then right now, I just want to highlight for anybody that's currently on Medicaid, because we're in this public health emergency with COVID, nobody, generally speaking, there are some nuances to this, but generally speaking, nobody should be taken off Medicaid during COVID. This started in March of 2020. And it's right now in place until the end of April of 2021. And the expectation is that that's going to be extended even further. So right now, if someone's on Medicaid, generally speaking, they should not lose Medicaid, even if their income changes, their resource changes. So if anybody's in a situation where they're being told they're going to lose their Medicaid, please reach out to us at the Health Law Project so we can try to help you with that situation. Okay, so I just have a couple more slides, and I want to focus now on Medicaid long-term care through what are called waiver programs. So waiver programs, they're called waiver programs because essentially the state asks the federal government to waive certain rules that otherwise apply to Medicaid programs. So these waiver programs are targeted to certain groups of people, and it's certain groups of people that might otherwise need care in some sort of facility to get the support services they need. These are really important for people with disabilities, especially young adults who are transitioning, turning 21 and transitioning from that broad Medicaid coverage that's available to kids where they can get home health aid services or shift nursing services. Those benefits through Medicaid end at age 21. And so oftentimes people have to turn towards these waiver programs as ways to continue getting those supportive services to allow them to keep living at home in the community and be as independent as possible. So just some examples of services covered through waiver programs. There's personal assistance services that help with personal care. There's shift nursing services. There's employment supports available through the waiver programs, assistive technology. So there's a broad range of these support services that people may need to, again, keep them as independent as possible and keep them living in the community. Waiver programs are not entitlement. So Medicaid is an entitlement program. And so all of the things we just talked about earlier in my part of the training, if somebody applies for Medicaid and meets the criteria, they get approved for Medicaid and they get that coverage. For these waivers, some programs have limited slots. So even if somebody otherwise is eligible for a waiver, if there's not a slot available, you might be put on a waiting list. And this is especially true for people with intellectual disabilities and autism. Unfortunately, there's just not enough slots for the people that need these support services. So there are waiting lists for people in those systems. And then there are special eligibility rules that apply, because again, this is a Medicaid long-term care program. These are alternatives to facility-based care. So someone has to qualify clinically, and then if they qualify clinically, they have to qualify financially. And there are certain rules that apply to these waiver programs that are different from other Medicaid eligibility rules. And then if somebody gets a waiver, the services available differ depending on what waiver program you're in. And then once you're in the waiver program, there's a service plan that's developed to target services specifically to your needs. So if I'm in a waiver program and my friend's in a waiver program, we might be in the same waiver program, but our needs are different. And so I might be getting different services from my friend because everything is individually based and targeted to what that individual's specific needs are. Okay, and there's kind of 3 systems right now for waivers, or 2 systems, but the one system is kind of split into 2 sections. So if you're somebody with a physical disability or a developmental disability like spina bifida, muscular dystrophy, cerebral palsy, or you're an older adult, then you're going to access the waiver programs through the independent enrollment broker, which is Maximus right now. You're going to call this phone number, and they'll walk you through the application process. If someone's 55 and older with a physical disability, another option for them is the LIFE program. So if you're in the Pittsburgh area, there's Life Pittsburgh, Community Life, other areas that might be called Senior Life. So if you're interested in the LIFE program, that's an adult day center model where typically you get all of the services you need at the LIFE program, then you contact the LIFE program to start the application process. Then the next 2 kind of doors or pathways are through the Office of Developmental Programs. So if you're trying to access services for a person with autism, then you contact the Bureau of Supports for Autism and Special Populations, and you can find more information at the link on the slide. And then for people with intellectual disabilities, regardless of their age, then the entryway to those services is by contacting the County Office of Intellectual Disabilities in the county where you live. And so sometimes the offices are called off, maybe the County Office of Developmental Programs, maybe it's Mental Health and Intellectual Disabilities. And so the link on this slide will direct you to the county office in your county where you contact to get started with applying for those programs. So there's different pathways to access these waiver services, but then once you've gone through the steps and are determined clinically eligible, then the financial eligibility is the same no matter what waiver program you're trying to access. So next slide, Sarah. To qualify for a waiver, the eligibility is based only on the person's financial situation who is trying to access the waiver program. There's an income limit of $2,382 a month. Again, only the applicant's income counts. There is no deductions and disregards. So if somebody has $2,400 worth of income each month, they are going to be slightly over that income limit and not meet that and be over income for the waiver. There might be some ways to deal with that. And then there's a resource limit of $8,000 that applies to anybody who's over the age of 21. There are some special rules that apply for the resource limit for the waiver. They'll look back 5 years. You're going to have to provide bank statements from the last 5 years so that Medicaid can look to make sure whether you transferred any resources, gave money away to try to qualify for these programs. But again, houses don't count. One car doesn't count. There are other resources that don't count towards that limit. Okay, Sarah. If somebody is clinically eligible for a waiver, but the only reason they don't qualify is because their income is over the income limit, then one option is the MAUD program. And if somebody, there's a special rule in Pennsylvania where if somebody is eligible for the waiver based on their clinical status, but if they are financially ineligible for the waiver but can qualify for the MAUD program, then they can be eligible for both MAUD and the waiver benefit. So that's a really important kind of special nuanced rule. And if people have questions about that, we can reach out to me. My contact information is at the end of the presentation. And then there's also kind of an option where people can spend down to the waiver limit, and people can reach out to the Achieve a Family Trust or reach out to us at the Health Law Project, and we can talk to you more about that. Everybody who applies for a waiver will get a written notice of approval or denial. And again, all denials can be appealed. The other thing to kind of keep in mind with the waiver is that the application process takes time. There's lots of steps involved. So especially for people that have physical disabilities or developmental disabilities or who are older adults, you don't want to wait until the point where you need the services to apply, because it's going to take 2 to 3 months to get through the application process. And once you get approved for the waiver, you have to have a service plan developed before the waiver is going to start to pay for any of the care you need. So we really encourage people to kind of act quickly, act as soon as you can to kind of start that process, get connected to the intellectual disability system, the autism, the programs that serve people with autism, or the other programs for people with physical disabilities, so that you're not kind of stuck in a position waiting for care that you need because you're waiting for that application to be processed. Okay, and then there's some resources on the next slide that might be helpful to you all when you get the PowerPoint. And then my contact information is the last slide here. So please reach out to us at any time. We'll do our best to kind of advise you, direct you, or help you with an issue accessing Medicaid coverage or services. So I guess, Maria, do you want to take questions before I turn it over to Jeff?
Yes, just a couple quick things, Erin. A number of people have asked if there are similar organizations such as PA Health Law in other states such as New York and Ohio. Wondered if there were similar organizations.
Yeah, I think you can connect with the legal aid offices in New York and Ohio and see if they have a specialty program. I know New York has some I think organizations that are specific to people with disabilities that probably do similar work to us. So, and if I can find some resources and maybe share it with you, Maria, and then you can send it out to the people on the training.
That'd be
today.
great. The other quick question is about if someone is living in the United States on a visa trying to get citizenship as a green card, are they eligible for Medicaid?
Possibly. So again, there's different citizenship rules for different categories. So if somebody is lawfully present with a work visa, they may be eligible for the Medicaid expansion, or if it's a family, they might be eligible for coverage. So if there's more specific questions about that, reach out to me and I can give you some more information.
Okay, and one last question, is the home and community based the same as the LTSS program?
Yeah, good question, right? All these acronyms, yes. Yes, LTSS means long-term services and support. So I think that's kind of the newer term for these home and community-based waiver programs. So yes.
Thanks. Okay, and that's it. I think we can transition.
All right, great. So I'm going to turn things over to Jeff Ash, who's the Senior Trust Administrator with Achieve a Family Trust.
Okay, hello, can you hear me okay?
Yes.
Okay, hi. So thanks for allowing me to take a few minutes to share a little bit about housing subsidies, HUD in particular. I don't want to make an assumption that people have not heard of the word HUD before, so I just want to share a little bit of history. So the Housing Act, that's kind of where that started in 1937. And you can see from this slide there, I'll give you a moment to read that. Okay, next slide there, please. So a little bit of the history regarding the Department of Housing and Urban Development. Everyone, I would think, it has heard of HUD, and that has been created under President Lyndon Johnson's War on Poverty. Basically, in 1965, things started to move forward. The purpose or the mission was on a national level to address housing needs and improve and develop communities and enforce fair housing laws. But it should also be noticed that HUD also does play a major role in underwriting home ownership for lower and moderate income families through various programs and mortgage insurance programs. The one thing I want to emphasize now, and I'll emphasize at the end, is that HUD considers income. It's not, they're not considering assets, and that's a big distinction. And we'll cover a little bit about that, what are income inclusions and what are income exclusions. So before I mention that, I just want to just share a little bit about the history of vouchers, just to give a little background on, why we have housing programs and why they're important, meeting the needs of our folks in the communities of all disabilities, ages, things along those lines. So until the 1970s, as you can see, nearly all federal housing assistance was provided through public housing developments, but folks started to realize that that was concentrating on poor families, keeping them in certain neighborhoods, and it just wasn't spreading the importance of integration. So in 1998, Congress passed the Quality Housing and Work Responsibility Act. You've heard of Section 8. The term really that folks use now is housing choice vouchers, but they basically are the same terminology. So in short, HCV is often used. Now, I want to mention about the income inclusions. I'm just going to hit the high points. The full amount of things like payroll taxes, wages, salaries, bonuses, tips, things like that. These are things that HUD's going to count as income. They're going to count dividends or interest you may earn from an asset, not the asset itself, but just the income that's derived from that. So that's a distinction to be aware of. Payments that might be made in lieu of earnings, such as unemployment, disability compensation, things along those lines. Those things are counted as well. Some of the income exclusions, and I'll just list a few just so you can be aware. Income from employment of children that are under the age of 18, they're not going to count that. Lump sum additions to a family's asset, an inheritance, things along those lines, they're not going to count that as income. Let's see what else here. Something that's temporary or non-recurring, they're generally not going to count that as income. So I'll give you an example. If you have someone who gifts $500 to you, HUD's not going to count that as income, but if they gifted you $50 a month for 12 straight months, they will count that as income. So that's how they look at that. There are other things that aren't counted as income. If you happen to be a caseworker, or you happen to have yourself or a family member that is receiving reparation payments by, say, a foreign government because you fell under the laws of, for example, payments made to the victims of the Holocaust, things like that. Those types of funds that you receive aren't counted as income. And so those are kind of the high points in terms of income inclusions and exclusions. So I want to get back to how does public housing work. So as you can see from the slide, public housing programs, they're called PHAs, public housing agencies. They basically operate the housing for the low income families. HUD has national rules, but each individual public housing authority or public housing agency, they have their own discretion to set their own internal rules for the program in your area. Vouchers. There are, I'll go over the two basic types of vouchers. You have tenant and you have project-based. Tenant-based would be for, it's mobile, it's a certificate. It's kind of it represents your ability after you've been screened to be able to take it, link up to a Section 8 landlord and be able to live in the area that you would choose to want to live in. And that goes back to the original slide I mentioned in the beginning regarding about the ability to have folks live in places that they choose to. So the tenant-based assistance itself, that is the Housing Choice Voucher, the HCV program, that's on slide 7. The assistance is tied to the family. Yeah, thank you. Assistance is tied to the family. The family selects their unit. The Public Housing Authority approves or disapproves the unit. Again, the voucher is mobile, so you can go anywhere in the country where that program exists or is permitted or has the funding. And in short and in summary, the voucher program, it allows people the freedom to select housing where they want to live. Now, the tenant-based assistance, the key difference here is that it's tied to the unit. So somebody who is applying for subsidization at a high rise, say they're 62 years old or older, it's not so much that it's a mobile voucher they're using. The subsidy is built within the unit itself. You do get approved. You have to go through the similar process, but the subsidization then is still afforded to you, the subsidy itself. Okay, there's a few slides I'm just going to skip. If we could go to HUD eligibility on page 11. So HUD, as you can see, sets its income limits that determine eligibility for assisted housing programs, and they develop income limits based on median family income estimates and fair market rent area definitions for each area, parts of the metropolitan areas in each non-metropolitan county. There, at the end of the slide, or at the end of the presentation, there's a sheet I have with links that you can look up your particular area. You can see where that rate would fall in terms of the median income, who would be eligible for HUD housing in terms of the subsidization. But basically there's 3 income levels. There's extremely low income, that's usually less than 30% of the median family income. And then there's very low, that's usually less than 50%. And then there's low, that's less than 80% of the median family income. So to be eligible for the voucher program, slide 12, a family's gross annual income must be less than 80% of the area median income, as I mentioned. Each public housing authority or public housing office must adopt preferences for families who earn at or below 30% of the area median income. HUD does not prioritize housing, but the mission and vision is carried through to the local housing agency, housing authority, to really promote and find ways to meet the needs of individuals and families who are at most risk. Traditionally, a person or a family should contribute roughly 30% of what they call total tenant payment. That's after adjusted gross income to determine what amount of money they're responsible for their housing. And on page 13, there's just a small little example, but I do want to mention that annual income is defined as all earnings, as I mentioned earlier. That includes employment wages, public benefits, and disbursements from investments and pension plans. So in this example, a senior citizen receives $800 in Social Security disability. She also receives $200 from her deceased husband's pension plan. So that's $1,000. So the gross annual income is $12,000. As head of household, and there is a deduction that is allowed to be provided by HUD. So here it's $400 to shave off a little bit of the gross earnings and get it down to an adjusted earning. That income now is $11,600. She now will pay approximately $290 per month in rent. And you could see that $11,600 divided by 12 equals $966.67. at 30% her contribution rate. Now, what's not included in here is that there are deductions that you are allowed to take to lower your adjusted gross income. But that gets a little cumbersome. So we'll just kind of just make sure you're aware that there are adjustments that can be made. There are deductions. Your housing manager that's representing where you live would be able to assist you in doing that. Again, I just want to focus and remind you that HUD is really about income. It's not about assets. So I give this example, you know, if you won the lottery and it's a lump sum and you get that money, it's not going to be counted as income under HUD. However, if you were to receive $1,000 every month, and that's on a regular, ongoing, recurring income source, they are going to count that. Okay. I can skip to, I'm not going to go over how they determine the passbook savings rate. That's something that you could just look into, but income that's derived from an asset, HUD does look at that. They don't look at the asset itself, but they do count any income that's derived from that in their tabulation of how they adjust their rent toward you. Okay, so I'm going to give an example about that. If you skip to page 18 for me, please. This would be an example of imputed income from assets. So we're going to use the example with Jim. Jim holds a Section 8 voucher. He's paying $150 a month in rent. Last year, unfortunately, his mom passed away and left him with $3,500 in stocks. This slide is on page 18. So from those stocks, $360 was end of year dividends. That equals to about $30 per month. So Jim's going to have to pay $9 more per month toward rent. And that calculation came out as follows. The annual income from the stocks was $360 divided by 12. It's $30 each additional per month times the 30% subsidization rate. So his rent went from $150 to $159. The $3,500 was not what was counted. That was an asset, but the income derived from that asset was counted. Just a couple other things I want to mention regarding HUD. You know, the Federal Housing Administration, that's on page 19, that is a branch of HUD that works through local mortgage lending institutions to provide federal mortgage and loan insurance for home ownership and construction or improvement of affordable housing. So that's another terrific avenue people can take to try to find affordable housing and home ownership through the FHA. I do want to mention a little bit about our service men and women, our veterans on page 20. There is assistance through HUD through specific type of funding and concentration for our veterans, and that is through what's called a HUD VASH, V-A-S-H. So the HUD Veterans Affairs Supportive Housing, that program combines rental assistance for homeless veterans, along with case management, some clinical services that's provided by the Veterans Affairs. So dollars are used by HUD to meet the needs of different populations, so to speak, targeting age groups, different types of disabilities. So housing is kind of unique in the sense that it's not a standalone where you just apply for something and you just apply. I mean, some of the buildings that you can live in, you need to be 62 or older, or they may have mixed subsidies within a building that have the mission to meet different needs for our community members. Some individuals may need supportive housing. some folks could not live necessarily by themselves and they need that extra assistance, but the subsidies are still built in. Many nonprofits run supportive housing units. Those are dollars that are provided for the ability for nonprofits to provide that service in our communities. And the homeless arena, that's a big one when it comes to housing. That's on page 21. So is there any assistance for individuals that are homeless or, you know, even transient, what have you? I mean, folks that are really needing help. So HUD does provide funds to state and local governments and to nonprofit organizations to assist homeless individuals and their families. The funds are used to help the homeless move from the streets to temporary shelter to supportive housing. The Office of Community Planning and Development administers most of the homeless assistance programs. It was back in 1987, I believe, the Stewart McKinney Homeless Assistance Act. That was very critical for anybody who worked in the homeless arena. That really was the first time HUD programs were really set out to combat homelessness in terms of really promoting housing. So, and I think our county in particular has done a wonderful job. Lastly, on page 22, housing resources. I would recommend that the first two just take a look at when you have a chance and just navigate them. The first one, the HUD resource housing map, it's wonderful. It's almost like Google Earth. You zoom in on an area, a city, a county, anywhere in the country. It'll pull up tons of available housing. It'll pull up tons of available links that you can isolate for your specific need. The next housing resource underneath that one, called pahousingsearch.com, is another wonderful housing search engine. You could really isolate where you would like to find housing, what your age is, what you want. Do you have a voucher? Do you not have a voucher? Is the place that you're looking for subsidized in any way? Is there a price range you're looking at? Is there social services built into the building that you could, you know, enjoy as a tenant there? Things along those lines. So those two are really nice resources to check out. The rest of it, most of it does pertain to Allegheny County. There are links there for Allegheny County Public Housing Authority. Allegheny County in itself is represented there, and of course HUD itself. So you can just look at those housing resources and hopefully gain some information. The bottom line is, if you have questions regarding housing and subsidization and your eligibility and just navigating the need to find safe and affordable housing, contact your local public housing authority. Talk with them, see what you have to do, and they'll provide that information in real time for you. I'm sorry for running a little long. I know you guys have a lot of things going on. I appreciate your time and thank you.
Thank you. Hi, so my name is Nancy McMillan. I work with the Chiva Family Trust, of course, and I'm doing a session on food stamps. The new term is called SNAP, Supplemental Nutrition Assistance Program. So if you want to go to the first slide, this will only take about 10 minutes, which is good. We only have about 15 minutes left. So what is SNAP? It's a federally funded program through the U.S. Department of Agriculture and administered and managed by the Department of Human Services. Another name of that is the Office of Income Maintenance. SNAP assists eligible individuals and families to supplement food expenses and have access to nutritious foods. The SNAP benefits are accessible through the electronic benefits transfer card. It's often referred to as an EBT card, so it fits nicely in someone's purse or wallet. You could take it to the grocery store with you and you swipe it just like an ATM or a credit card. And so basically it's quick, efficient, and it calculates how much is left on the card. And so it's a good process. It's a good way to use the money for the food stamps. So if you want to go to the next slide, how to apply. Pennsylvania allows for actually 3 basic ways to apply. One is by filling out a paper application. It's called a PA 600 form. This form is kind of a general application that would include medical assistance, SNAP, and TANF. But then the second easier application, it's just a couple pages long, is the PA 600 F as in Frank. And that's only for food stamps or SNAP. And then the third way is to go online through Compass. And that online website is compass.state.pa.us. And in doing the whole COVID thing, it might be quicker and easier to use the Compass. But if you have to use the paper application, then as Aaron Gay said, you can drop off these applications at the local county assistance office. There's a lockbox and they'll be acted upon. So because you can't actually see a person at the county assistance office, I'm just going to suggest that you do it through the online Compass. So the application is date stamped the day the application is received. And from that point on, for normal processing, the OIM, Office of Income Maintenance, has 30 days to process the application for ongoing SNAP benefits. So 30 days is the normal processing length of time that it takes. But there's, in the next slide, you'll see another process called expedited SNAP. And what's wonderful about this, all applications are reviewed for expedited SNAP benefits the day the application is received. So if the individual and the family meets the criteria for expedited SNAP, they must have access to that benefit. The family must have access to the benefit within 5 calendar days, and the EBT card must be issued on or before the 4th calendar day. So if you go on to the next slide, so who really qualifies for expedited SNAP? They have to meet the following criteria. It could be a migrant or seasonal farm worker who are destitute with $100 or less in liquid resources. It could be a person with the value of their total liquid resources is $100 or less, and the countable gross monthly income is less than $150. Or it could be a household's combined monthly gross income and liquid resources are less than their monthly shelter expenses, which is typically rent and utilities. So those are the 3 categories of populations that would be qualified for expedited SNAP with the 5-day period of time. So if you want to go on to the next. For the SNAP interview, now remember there's no in-person interviews, but there could be phone interviews. SNAP interview is required for processing the very first or initial application for the ongoing SNAP benefit, and the client will receive a letter or a notice, PA 253, giving them the interview date and time. So the next slide deals with what is a SNAP household. Anyone that purchases and prepares food together. Applicants in a SNAP household are not required to live together. So what that means is that a person, such as a relative, can live apart from you, but then you prepare and you purchase food together. This happens quite often. You can also be defined as a SNAP household as a mandatory household, which is spouses and children under the age of 22. That's considered a household. And then the third way to be counted as a household, it's an individual at the age of 22 or above can live with their parents, but be on their own SNAP budget if they purchase and prepare their meals separately. So this is helpful for a college student coming home, they're finishing college or going into graduate school or starting a new job, and they want to temporarily live with their parents, but they, because they can't afford to be on their own yet, but they can have their own SNAP budget if they purchase and prepare their meals separately from the rest of the family. So this is a very generous feature about SNAP. So what are the maximum benefits amounts of SNAP? So these just came out January through June of 2021. Because of COVID, they have increased the maximum benefit amounts by about 15%. I have read and was told. So you can look at those maximum amounts for a family size of 1, 2, 3, 4, and on up. So that's helpful, in purchasing food every month that's nutritious, and it can augment someone's budget tremendously by getting these benefits. So if you want to go to the next page, you'll see that certain income and resources are counted depending on the age of the person and if there's a disabled member living with them. So households having an elderly person over 60 or a disabled person, there will be no resource limit, and their income limit is higher that is counted than the next category, which is no elderly person and no disabled member. And then they talk about a person being sanctioned or disqualified, and all that means is that someone who had committed fraud previously using food stamps would become a category called disqualified or sanctioned member. So really the two categories you want to look at is the first line and the last line. And the last line just says households having an elderly disabled member with an income above 200% federal poverty income guideline will have a resource limit of $3,500. So instead of trying to break this down even more, what I was told was that you really have to apply and talk to somebody through the phone interview or through Harrisburg to really understand what the new income and resource limits are for 2021. Now, how often are food stamps and or SNAP approved? Well, the renewals are completed annually, but they're reviewed every 6 months. So there's an annual review once a year and a semi-annual review. So keep that in mind. You'll get a letter in the mail every 6 months asking for information about your household income and your resources, how many people are living with you. And also they take into consideration the amount of your rent or mortgage. And they also ask you for your medical expenses. So these are reductions or deductions that they can make from your income every month to qualify people for SNAP or for a higher amount of SNAP. So you will be asked those questions on the application to begin with, but also reviewed. Now, I was told that when there is a change in income or resources, whether it goes up or down, you have 10 days to report that change to your office, to your local county assistance office for SNAP. So keep that in mind, 10 days to report the change, whether it's going up or down. Now, going to the next slide, I want you to know that you can contact me. This is my contact information, but I also attached some flyers and brochures for you to read, and I think you'll have access to those once it's all printed out. So the flyer, one of the flyers is from the Benefits Data Trust. It's an agency within 6 counties of Southwest Pennsylvania that actually help you apply for SNAP. So one of the flyers, keep in mind, will help you apply for SNAP. It also helps you apply for some medical assistance, childcare assistance, disability benefits, prescription drugs, SSI, ssdi. So these are wonderful. This is a wonderful service, and the counties that they cover are Armstrong, Allegheny, Beaver, Butler, Westmoreland, and Westmoreland counties. And that's our local BT Benefits Data Trust Agency, and their helpline is, I'm going to give you the phone number for it now, 844-876-5333. 996. So if you're in need of SNAP quickly and you want to also apply for other types of subsidies, such as the property tax rebates, the child care assistance, the prescription drugs, health insurance, et cetera, you would be able to do this also through the Benefits Data Trust. And just to let you know, there's also a website you can get. It's called www.bdtrust.org, or you can actually connect. These are critical public benefits during COVID-19. It would be accessing them at bdtrust.org/get-help. So I hope that's a good resource for those who are living in these counties, but I was also told that there are other counties on the East Coast that you might be able to get help through their helpline. So thank you very much, and we'll certainly take some questions for all the presentations.
Nancy, this is Maria. We had one question for you on SNAP. It says, the question is, what if some household members share some meals, but not all? That is individual breakfast and lunch, but share dinner.
Well, that's an excellent question. And to be honest with you, I would not feel confident giving you a definitive answer, but I would refer that person to the county assistance office, or there's a helpline in Harrisburg. And let me give them that helpline. That's a good question to ask from the horse's mouth. So just go ahead and ask that question. And that phone number, if you want to just hold on a minute, I'll access it. It's 1-800-692-7462. And that's a helpline at the Department of Human Services that you could ask that question. Again, it's 1-800-692-7462. Any others?
Nope, that's it.
Okay.
Thank you, Nancy. I appreciate it. This is Patty again. I just want to thank all of our presenters again, Elaine, Cole, Aaron Gay, Jeff Ash, and Nancy for your presentations. They were fantastic. I am confident that everyone learned a lot today. And I know that this is a lot of information to digest and take in, but as a reminder, this webinar is recorded and will be put on our website probably by the end of day today. The end of day tomorrow or Monday at the latest. I also will be sending out slides to everyone in attendance in the next day or two. So please keep an eye out for those as well. There were so many good questions, and I do hope that we were able to answer most of them, but you will have all the presenters' contact information when you receive the slides. So if you have more questions, please reach out to them or reach out to me, and I'd be glad to try and answer your questions or direct them to the appropriate people. So again, thank you all for coming. We are really excited for our last two webinars, and we hope that you can join us for the remaining two. Next month, we have one on special needs trusts and ABLE account. And Jackie Connell, who is the staff attorney at Achieve Family Trust, will be speaking along with Ryan Buxton, the field representative for Pennsylvania Treasury. Jackie will be speaking on special needs trusts, and Ryan will be speaking on ABLE accounts. So I hope you can join us for that one on March 16th. And then our last one in April is called Money Management Resources. And we have a panel of presenters that day. Rebecca Johnson from the Pittsburgh Financial Empowerment Center, Susan Takow from the Pennsylvania Assistive Technology Foundation, and Catherine Rhyme, who works for Achieve a Family Trust and does funding assistance for PATF as well. So we hope that you can join us for the remaining two. If you're interested in more information on these programs or information on how to register, you can visit our website at achieveafamilytrust.org. So again, thank you all for attending this program, and we look forward to seeing you next month.